Our department has encouraged states to think differently and creatively about how to solve the many health issues facing Americans.
That was USDA Secretary Brooke Rollins from earlier this month, announcing a total of 12 states, including Iowa, have now been granted waivers from the Federal Ag Department to restrict the purchase of so-called junk food with SNAP benefits. Tonight, we're digging deeper into these waivers, which the Trump administration calls a bold, common sense approach. SNAP is the nation's Supplemental Nutrition Assistance Program, the 2008 name change given to the Food Stamp Program to reduce stigma. It provides food assistance to low-income individuals and families. Of the dozen states granted waivers to date, most will restrict the use of SNAP funds on soft drinks or sodas. Some will also restrict candy purchases. According to Health and Human Services Secretary Robert F. Kennedy Jr., these waivers help put real food back at the center of SNAP, empowering states to lead the charge, he says, in protecting public health against diabetes and other chronic diseases. So let's put this up. This is the map that shows SNAP food restriction waivers now in place. The green states highlighted there. Iowa's waiver is unique in its wording. It restricts any food item eligible for sales tax per the state's revenue department. So we're talking about things like soft drinks, candy, and sweetened snacks. The Hawkeye State's SNAP waiver will take effect on January 1st, and it's good for 2 years. The Iowa Hunger Coalition is sounding off on the state's federally approved waiver, however. Its vice chair writing in part, quote, "Instead of investing in evidence-based solutions to improve healthy eating, the state of Iowa is choosing to experiment on low-income Iowans' grocery carts. The only thing we know this will do is increase stigma for SNAP participants," end quote. More than 20 years ago, Minnesota sought to restrict junk food purchases with what are now known as SNAP benefits. It came under the lead of Republican Governor Tim Pawlenty in 2003. However, the state's waiver request was denied in D.C. based on implementation challenges, food definitions, and the potential stigma of benefit recipients.